Welcome to the deep dive. Today, we're looking into something that's really changing healthcare, telehealth.
hmm
We're going to focus on one example, Stark Medical. They're based in Chico, California. But here's the interesting part. They see patients virtually across the whole state.
Yeah, it's a fascinating model.
We want to figure out how this works,
hmm
how you could potentially get healthcare without leaving your house, and maybe uncover some surprising things about just how effective this can be.
Exactly. We've been digging into Stark Medical's website, looking at their primary care services, their FAQs, really trying to understand it from a patient's perspective.
Right.
So our mission for this deep dive is basically to map out their telehealth services, how it all functions, and answer the kind of questions you'd likely have if you were thinking about signing up.
Okay, sounds good. So first off, if you're looking for care in California and you hear about Stark Medical, who are they? Who's on the other end of that screen?
Well, Stark Medical is, at its heart, a primary healthcare practice. They do have a physical spot in Chico, but the big thing is their statewide telehealth service.
Gotcha.
The main providers are Dr. Brandon Stark and Yvette Stark, who's a board-certified nurse practitioner. And importantly, they are taking new telehealth patients from anywhere in California right now.
So that really opens up access, doesn't it?
It really does. And we're not just talking about, like, a quick call for a sore throat, though they
Right.
do that too.
Okay.
Their focus is pretty broad. Primary health care, obviously.
hmm
Getting prescriptions, handling refills, that's a big one for ongoing care.
hmm
And Dr. Stark, he has a special focus. He's board certified in addiction medicine and a fellow of the American Society of Addiction Medicine. So that's a key area for them.
Ah, okay. Specialized care, too.
Yes. Plus managing chronic conditions, think high blood pressure, diabetes, that sort of thing. They also do have limited in-person appointments in Chico, like 1 week a month if that's needed or preferred.
That flexibility seems key. So let's get specific. What primary care services can someone actually get through a video call with Stark Medical?
Okay, yeah, the list is pretty comprehensive.
Mm.
For anyone 16 and up, you've got your standard primary care, prevention, wellness advice, treating common illnesses.
So basics.
Right. They handle routine screening exams, or at least get the process started. They can order blood work and lab tests. You just go to a local lab near you to get the actual draw done.
Oh, interesting. So they coordinate with local places?
Exactly. Same goes for major cancer screenings, like for colon cancer, PSA tests for men, mammograms. They can order them remotely, discuss the results with you. Follow-up care, too.
That makes sense. And what about specific care areas like women's health?
Good question. Yvette Stark, the NP, handles well woman care via telehealth. So that includes talking about routine gyn health, breast health, reproductive guidance, menopause management,
Wow.
osteoporosis screening discussions, STI and pregnancy screening counseling. A lot of the consultation and management can happen remotely. Of course, if a physical exam is needed, they'd guide you on getting that done locally.
And the addiction medicine side you mentioned, how does that work virtually?
Dr. Stark provides that personalized, evidence-based care remotely. This can include medication-assisted treatment or MAT, addiction counseling.
Right.
And if someone needs a higher level of care, like inpatient rehab or a sober living place, they handle those referrals too. It's huge for access, especially as local options are limited.
Absolutely. Okay, what about chronic diseases? Lots of people deal with those.
Yeah, that's a big part of their telehealth service. Managing things like high blood pressure, cholesterol, diabetes, heart disease, even migraines.
So ongoing management.
Ongoing management, yeah. Medication adjustments, consultations about meds, and crucially, getting those regular refills sorted out. They can also order diagnostic tests, remote labs, but also imaging, like X-rays, CT scans, MRIs, DSC scans for bone density, ultrasounds.
They order it, and you get it done locally.
Precisely. They send the order to a facility near you.
It really seems like they cover a ton, even like the everyday stuff, feeling sick.
Oh, yeah. Colds, flu, COVID. They can treat symptoms like coughs, sore throats, fevers, respiratory infections.
Okay.
Common infections, too. Ear infections, UTIs, bronchitis, sinus infections, skin infections. They handle the treatment and any follow-up needed.
What about mental health?
They offer support for depression, anxiety, PTSD, and also things like seasonal allergies, contact dermatitis, managing mild asthma, basically a very wide range of common primary care issues.
Okay, the range of services is definitely impressive. Now, the practical side, how does an appointment actually work? What do you need to do?
Right. So telemedicine at its core is just using tech to talk to your provider remotely. With Stark Medical, you'll need the basics: a computer, tablet, or smartphone, Has to have a webcam and microphone.
Standard stuff.
Pretty standard, yeah.
Yeah.
And a stable internet connection, obviously. They use a secure platform that's IPA compliant that's super important for privacy.
Absolutely. And I saw something about a patient portal being necessary.
Yes, definitely. They require all telehealth patients to register and use their patient portal. Think of it as your secure online home base for everything related to your care with them.
So it's more than just for appointments.
Oh, yeah. You use it to send and receive secure messages with the team, which cuts down on phone tag. You can access educational materials they share, look at summaries from your visits, see your lab results.
Right.
It centralizes everything.
That sounds pretty efficient, actually. Okay, let's dive into some common questions people probably have. Getting medication refills, how does that work?
Yeah, always a big question. Their process is straightforward. They actually suggest calling your pharmacy first for routine refills, because often the pharmacy can just request it.
Ah, okay.
But if Stark Medical needs to process it directly, like for a new script or certain types of meds, they ask for at least 5 business days' notice.
5 days, why so long?
Well, it gives them time to properly review your chart, make sure the refill is appropriate, and handle the electronic prescribing. It's about safety and thoroughness. But they do say, if there are urgent things like prior authorizations needed, let them know. They'll try to help quicker.
Okay, that makes sense. 5 days as a general rule. Now, another big one. How effective is this? Can a doctor really diagnose you accurately over video compared to in person?
That's probably the #1 concern people have, and it's valid. But the research is actually pretty encouraging. Studies have shown that for a lot of conditions, diagnostic accuracy via telehealth is very similar to in-person visits.
Really?
Yeah, there was a big systematic review, I think it was in the Journal of Telemedicine and Telecare, that found strong evidence for it across different medical areas. And treatment outcomes, too, for things like chronic diseases, mental health, dermatology, even some infections, the results are often comparable.
So you're not necessarily sacrificing quality for convenience.
Generally, no. And patient satisfaction tends to be really high with telehealth. People love the convenience, the accessibility. Plus, some studies even suggest it might reduce overall healthcare, use fewer ER visits, maybe fewer hospital stays, because issues get managed proactively.
Interesting. But what about the physical exam? Listening to your heart, checking blood pressure. How do they handle vital signs?
Good point. This is where you, the patient, play a more active role. Stark Medical encourages patients to monitor their vitals at home.
Okay, like with a home blood pressure cuff.
Exactly. They even recommend using validated devices. There's a website, validateebp.org, that lists reliable ones. And interestingly, some research shows home blood pressure readings can sometimes be more accurate because they avoid white coat syndrome and reflect your normal environment.
Huh. Never thought of it that way.
So during your visit, they'll ask you to report your weight, maybe your temperature if relevant, and definitely your blood pressure readings.
So you become part of the data gathering team?
Kind of, yeah. And with things like Apple Watches and other health trackers becoming so common, people are getting more used to monitoring their own health data anyway.
True.
For diabetic patients, sharing home glucose readings is already standard practice and absolutely vital for management. But it's also crucial to remember diagnosis isn't just about vitals.
Right. The conversation matters.
Hugely. A thorough medical history, really talking through your symptoms, that's still the core of it. Stark Medical specifically mentions they take extra time to really listen and ask detailed questions during telehealth visits to make sure they get the full picture.
That's reassuring. Now, what about the tech itself? Some people might feel, a bit intimidated by setting up video calls for doctor's appointments.
Yeah, tech anxiety is real. Stark Medical seems aware of this. They emphasize that they try to make it easy. Their website has info, and they encourage people to call if they're unsure.
Is there someone specific to help?
Yes. They mentioned their office manager, Courtney, is available to help folks get registered on the portal and feel comfortable with the steps for the appointment. So it sounds like there's support there if you need a hand getting set up.
Good to know. Okay, what if you need something beyond the virtual visit itself, like, say, a referral to a specialist or imaging? Can they handle that coordination?
Yes, absolutely. They highlight that they're well connected with local institutions and supportive care. So they can electronically order those lab tests we talked about. They can send referrals to specialists near you, arrange for imaging like X-rays or MRIs, and send prescriptions electronically straight to your local pharmacy.
So they act as the central hub, even if parts of the care happen elsewhere physically.
Exactly. They seem confident they can manage most of that coordination through their telehealth setup.
But they must recognize that sometimes you just need to be seen in person. Right.
Oh, definitely. They explicitly acknowledge that some situations just require a hands-on exam or in-person treatment. They say their priority then is ensuring continuity of care, helping you get connected to whatever in-person service is needed smoothly.
Okay.
And as we mentioned, they do have that plan for rotating in-post and clinic days in Chico eventually, which adds another layer for people nearby or who might occasionally prefer face-to-face.
Right. So for someone listening anywhere in California thinking, okay, this sounds like it could work for me, what's the first step? How do they become a patient?
It seems pretty straightforward. Two main options. Call their office. The number is 530-514-0904. Or you can go to their website and register directly through the patient portal.
And just to confirm again, this is open to anyone living in California.
That's what they state clearly. All California residents, regardless of where you are in the state, can access their telehealth services.
And that patient portal using it is mandatory for telehealth. No way around it.
Correct.
Hmm.
They require registration and use of the patient portal for all their telehealth services. It's the main channel for communication, appointments, and accessing your info.
Okay. So let's wrap this up. It sounds like Stark Medical is offering a really wide range of primary care checkups, scripts, chronic disease management, even addiction support virtually to the entire state of California.
Very much, yeah.
They handle the coordination for things like labs, imaging, referrals, all remotely. They use a required patient portal, offer support for the tech side, and acknowledge when in-person care is necessary. Getting started is a call or online registration. It really feels like a modern approach to making healthcare more accessible.
I agree. It's a solid example of how telehealth can broaden reach and offer convenient, patient-focused care. They've clearly put thought into making the virtual model work comprehensively.
Definitely. So here's something to think about as we finish. With options like this becoming more common, how might it change the way you approach your own healthcare? Your preventative checks, managing ongoing issues? Could the convenience of telehealth make you more proactive? And thinking bigger, what other parts of healthcare do you think could really benefit from this kind of remote delivery model in the future? Definitely some food for thought there.
Absolutely. Lots to consider about the future of care delivery. Thanks for exploring Stark Medical's approach with us today.